welcome here to the show, Professor Dr. Sabrina Leal Garcia. You are a true pioneer at the crossroads of medicine, psychiatry, psychosomatics, and nutrition. Welcome here in the show.
Thank you for having me.
You're not only a medical doctor, psychiatrist, and scientist, but you're also one of Europe's leading experts in nutritional psychiatry. And from your early days in clinical research to founding your own center in Graz, Austria, you have dedicated your career to exploring how our minds and bodies interact, especially when it comes to food, mental health, and the gut-brain axis. So we will talk about your journey, scientific breakthroughs, and practical insights today, which hopefully a lot of people who are listening can apply to your own life. So I would like to start a bit unconventional with a song you selected. It is Shelter from the Storm. And it is interesting because we just had stormy weather around us. And maybe it's a bit, this line serves a line common, I will give a shelter from the storm, serves as the emotional and symbolic core of the song and represents grace, forgiveness, and unconditional love in a harsh, unforgiving world. Could you tell us why you've chosen this song?
This song yeah, for me, it is a very important song. I heard it, I think, the first time when I was still a small child, and it touched something within me. And I thought, because this is something also like the whole experience we have in life. There is something that cracks us open, that challenges us, and at the same time something that gives us shelter. And for me, it was very important. I've seen it through my life that there are these both sides which are very important for growth.
Yeah, I think so too. I mean, we have a world full of loss, pain, and disillusionment, right? And it has been like this for the couple of centuries, I'd say. So, I think this line underscores also there's the smallest gesture of kindness or emotions, positivity, a moment of connection or compassion can be transformation for each of us. And it's a kind of longing for a return of that we get back to our feelings, right?
Yes, and that these things can exist exactly at the same time also. So regardless of all the chaos we are experiencing, and also all the
Yeah.
yeah, all the turmoil that's behind the scenes, that there is something as empathy, as love, as connectedness, as kindness, and I think this is something also what the song tries to teach.
Yeah. So if we go from the song to your childhood, where did you grow up and what role did health or science play in your early life?
I grew up in a small town in eastern Austria, so near the Hungarian border. I was born into a working class family. So my father was a roofer, my mom was a secretary, and I was actually the first one in my family to pursue a university degree. So this
Wow.
was really something special. So you see, health and science were not really like a central part in my upbringing in any formal sense, I would say, but I always was a curious child, so I had a deep curiosity for the human body and how the mind works. And I spent lots of time in nature. I wanted to discover things. So it was rather like observation and not so much structured education. And I knew that in nature there were so many stories, and I wanted to learn how to read them.
And were there specific moments in your childhood that sparked your curiosity? Maybe you can share one situation with us.
Mm. Yeah, actually, when I was like 4 or 5 years old, I spent quite a long time in hospital. I had a growth disorder of my hip
Oh,
joint,
mhm.
and so I had to lie very still, like for weeks, because it was painful. Every move I made was painful, and so I was kind of a quiet observer of all the things happening around me. So I watched all, the other patients at the ward, the nurses, the doctors. And I thought, oh, this is interesting. There were some things that fascinated me, but also I saw, oh, maybe it would be nice to have some other things at the wards, and there are some improvements needed. And this sparked my first interest in medicine and my curiosity to be in this field.
Nice. And did you always want to work in healthcare, or was your career a kind of path?
I think it evolved like over time. So step by step, I did when I was small, I did not have like a clear image of becoming a
Mhm.
scientist or a medical doctor or doing nutritional psychiatry. But I wanted to know, why do people suffer? What is the root of many illnesses? What helps heal? And how does the mind and the body interact? And so later, my interest developed in the direction of psychiatry, psychosomatics, nutrition, the gut microbiome. But at the time, yeah, I thought it is just, developing step by step.
Mhm. And who were your early role models? You said your parents might haven't been your role models there in the course of their professional career, but have you had role models?
Mm. I would say my role model for life would be my grandparents, because I spent lots of time with my grandparents, especially with my grandmother, and she did not have like any academic experience or career herself, but she had some, what you would say, like some grounded wisdom, or she had a very sensitive way of caring for people and navigating life. She was full of strength, and this left a very deep impression on me. And for my scientific career, I had many great teachers. For example, also I spent half a year at the APC Microbiome Institute with Professor Dynan and Professor Cryan. And I think what always impressed me with the people and the teachers I met on my path were that they had this connection between also like thinking about the data behind, but
Mhm.
also see the people.
Great. This is, of course, a great, great gift that the human factor is there, also the social, the emotional part. And how did your time at the medical university shape your research perspective in the field that you figured out that it's important to bring these parts together?
So I would say that the medical university like provided me the foundation, and I had the freedom there to pursue my research interests. And this is like a new field also for the whole field of psychiatry. Of course, we had something like psychoneuroimmunology, but nutritional psychiatry was especially a very new field. And I'm very grateful that the Medical University of Graz provided me the time also, and also the background where I could start exploring this emerging field. And as I said, the other formative experience for me was my time abroad in Ireland, where I have seen the APC Microbiome Institute and met some leading researchers there. And
Mhm.
this profoundly influenced my thinking and deepened also my understanding, and also to understand how interconnected the systems truly are.
Mhm. And you already said it's a growing field, this nutritional psychiatry. Um, and it's a field, and I'd say, I mean, everybody should know about this, and everybody should know about this combination of the things, because in the school medicine we often look at shelves, we often look at boxes, and we like to put the things into, or give the things a name, and then say, okay, it belongs there. But we don't like if it's something special, or we have to combine things and get something new or individual, because it makes it harder to use things and results we already have. What's one scientific insight about nutrition and the brain and the gut that everyone might should know?
Um, I think it's really important to bridge the disciplines. So that you say, okay, there is a connection between the different body systems, because what we learn, like in general medicine, for example, we have one chapter about the immune system, one chapter about the endocrine system, one chapter about I don't know about every organ, but we never know how these things are interconnected. So this is one really important insight for me was when we were starting our research on the vagus nerve, because this is the nerve that mainly connects all parts of the body with the brain. It's also so important for emotion, for emotional recognition, for morbidity, for mortality. So this is the major connection pathway between also the gut and the brain, and it can influence also our levels of inflammation. And this is one thing I would say everyone should know about, that we can support the function of our vagus nerve, not only through proper sleep, but also proper nutrition and the healthy gut microbiome.
Yeah, this is super important, I think, because many people still think that mental illness is not possible to heal, and it's only possible to work with this with medicine, which puts the symptoms down, right? And the combination of psychological illness or mental health with nutrition is very new, and people don't like. I have often the feeling that people don't like also to understand that, in a kind of, don't take me away the red meat. I want to continue eating this red meat. And so behavior, which is a kind of, which has nothing to do with if it's good for our body or bad for our body, but if it is a kind of, how do you say, feeling good, which comes from experiences we have with a drink or with something to eat, or which feels like home, or is connected to feelings which have nothing to do with that.
Yeah, and it's often not about single foods, it's about the diversity of foods. Because some say, oh, I have these and that superfood I need to eat, and this one thing makes me healthy. It's not the one thing. It's like, here we see it again, this interconnectedness of things. We need a diversity. If what we eat is diverse, also the gut microbiome gets more diverse. And if we have diversity inside us, the vagus nerve can work, the organs are interconnected, also interconnected with our psyche, and also the social connections that we can make to others can then develop to be even more strong. And so I think the future, or one of the main future aims of medicine should be to see these connections between the dots.
Mhm. Connecting the dots is a very important point, also supporting the dots, right? So, if you, and we have maybe one last question before the break. What were the biggest challenges and breakthroughs in your academic journey, or where you would say, yes, this is something what I figured out, what is really amazing, or what is really important to know? I mean, you shared a little bit with us already.
Yeah, I think the biggest challenges were because it was a new field. Also, many colleagues said, "Oh, this is kind of alternative medicine, and it does not really belong to us. And why should psychiatrists be interested in food and nutrition and stuff like this?" So there were, yeah, it was quite challenging sometimes also to talk to my colleagues, because we needed a whole other vocabulary. And here you see also this problem that in medicine there are so many subspecialties and they never talk to each other, and so sometimes this vocabulary is missing. And for me, one important thing and also breakthrough is to get these different subspecialties to talk with each other, and to make these connections in order to help people, also to bring the things we knew from our research to the clinic to fill this gap.
I think this is super important because you have everyday patients in your hospital which are suffering and which often come to you after a long, long journey they have behind them, desperate, sometimes really wrongly medicated. So I'm happy to talk further with one of the leading voices in nutritional psychiatry, Professor Dr. Sabrina Leal Garcia. We discussed before the break the topic about patients, which come from a long, long journey often to seeing you, and you're often the only hope for them because your perspective is often different. You just said you have colleagues also from school medicine who have different perspective, of course, on the idea of psychiatry, on the idea how much nutrition plays a role there. And I think, I mean, we talked about your biggest challenges or breakthroughs, where you said, yes, this is the part where the things come together. And I understood how the things play a role together, and are showing also solution. So if we go a little bit deeper into this, can you once explain again what is your approach, and makes your approach unique compared to traditional therapy or just nutrition counseling?
Mm. Yes, we started our outpatients department for nutritional psychiatry over 1 year ago. And I think what makes our approach different is that, yeah, we take lots of time to see our patients. So if you have like the first appointment, it would take like 1.5 hours. We do a complete biopsychosocial anamnesis. So we ask kind of everything, even things that are seemingly not related to the primary complaint, because we want to have a full picture. And I think this is a very important thing, because when patients come to see us, they have already been, I don't know where, to many different colleagues. They often come, with 2 kilograms of letters from every kind of doctor, and so we take time to first, of course, to see the patient and to see him or her on the whole. And I think this is also what needs to be a foundation of this medicine. And we, of course, we also ask questions that a normal psychiatrist would not ask. Probably questions regarding what do you eat, but not only what do you eat, also how do you eat and when, and also why, what are the main reasons, what emotions do you have with that. So we are interested in the whole being sitting in front of us. And this is also what makes medicine interesting for us, because every day we learn something new
Mhm.
from and with our patients.
And what are the most common misconceptions people have about emotional eating? Because you just mentioned this.
Mhm. So I would say, with regard to emotional eating, yeah, that it's very important, because it's one of the main things how we can handle stress, and it also, yeah, our brain is kind of wired. If we are in lots of pressure, in lots of stress, we tend to then grab some chips, or some chocolate, or foods. And what are also addressing behavioral therapy. So for example, we try to teach them to not only yeah, to not only go for the chips or the chocolate, but
Mhm.
to notice kind of this gap in between, when you think, oh, now I have like a really strong emotion. It's interesting that I have it now, so that you think about your thoughts. We try it's called also meta perception or meta thinking, and this can help with emotional eating, and also to keep the nervous system and the vagus nerve calm and supportive in this case.
This is super interesting. Are there distinct psychological patterns that underlie obesity or and eating disorders?
Um, there are. I would I would say, of course, each person's story is unique, but there are
Mm-hmm.
some common patterns, I would say. So, underlying eating disorders or obesity, there is often trauma, there is often stress, there is often emotional dysregulation, also dysregulation of the vagus nerve. And many individuals we see, especially also with eating disorders, with anorexia nervosa, they struggle with problems with self-worth, with perfectionism. So
Mm-hmm.
everything has to be really perfect. And they tend to feel really like disconnected from themselves, from their bodies. So, and from a physiological perspective, of course, there are also common pathways like the chronic inflammation, like hormonal imbalances, like microbiome disturbances that also play a role. And so if you work like purely from a psychotherapeutic perspective, this one approach can fall short. But if I think we need to look at the whole
Mm-hmm.
picture, the biological side, the emotional side, and the relational side in treatment. And this is what we do also in our outpatients department.
Well, that sounds wonderful. It sounds like your hospital needed to be in in every country, in every city, to help the people.
I hope
Because
that
I
there
mean,
will other people be doing the same thing in other countries. I think I heard that there are other outpatients departments with our approach starting in Germany and Switzerland. So I
wow,
hope
that
in the future there will be more possibilities for the patients to
wow,
find adequate care.
this is really great news. How or what would you say? I mean, what major social or culture barriers are still there when we talk about food and health, which are barriers also for your work?
Mm. I would say one of the barriers is, as we talked about it before, is this reductionism that
Mm-hmm.
we still talk about food, or if we think about food, we think about calories, we think about weight, or we think about guilt. It's not about connection. It's not about this is something that could help me healing, or this could help me with my resilience. There is still this mind-body split,
Mm-hmm.
very common in medicine, so that mental health is something really different from physical health, and nutrition has nothing to do with if it is superficial. It's rather like for aesthetics or losing weight. So I think we need like a cultural shift also from that eating is not something about control. It's about care. It's about self-agency. It's about
Mm-hmm.
that we need the information, but also that it has something to do with our emotions and relationships.
Mhm. How do you stay motivated in such a demanding and evolving field? Because I mean, if I look around me myself, I see a lot of frustration around me, hidden aggression, depression, and if we look at anxiety and in this field of food and um, we, I'm sometimes shocked what I see around me, even when I look a little bit deeper at the people's life or behavior or their vision, mission, if there is one.
Mm. I would say for me, my motivation comes from my work because from my scientific work, but also from my work being with patients, because I
Mm-hmm.
see what is possible. Because
Mm-hmm.
also from the perspective, I've watched patients come back to life, to be more stable and more whole. And I also have the privilege to work with incredible colleagues here at the Medical University of Graz. I learn something new every single day,
Mm-hmm.
and the science is moving really fast now. So we have like new publications out on the gut microbiome, gut-brain axis, and nutrition every day. And what keeps me motivated is that there is so much beauty also in this work, that we learn so much about our environment, but also
Mm-hmm.
about ourselves. And um, we managed now helping quite a few people. And for me, I always remind myself, if I can even help one person, so this is enough. And so I keep doing it.
Great. I mean, you said it's your job. It's also that what you feel or what you get back from patients, I think, when you, their thankfulness, but also that you see that they are growing, that you could help them. What's one health habit you personally never skip?
Um, I have a very busy life myself, so I one habit I never skip is like eating mindfully. So take my time and
Yeah.
sit down and eat regularly, no matter how busy or stressful the day is. I eat slowly. I take the time to really taste my food.
Hmm.
This is yeah, it sounds simple, but it's like some yeah, it's nourishing, and I
Hmm.
love to eat with presence.
That sounds good. I mean, we know, and we talked also beforehand, that eating food is something which is very individual. So you can't say, for example, that this brain food everybody should eat because maybe one have allergy against fruit sugar. But are there any specific brain foods you swear by?
Um, what we recommend, so for many of our patients, the Mediterranean diet is the
Hmm.
diet to follow. But we always recommend, if there are no special gut problems, to have fermented foods as well, so such as kefir or kimchi,
Hmm.
also lots of berries because of the polyphenols, walnuts, omega-3 rich fish, and but as you said, it's more than one single food. We in our outpatients department, we totally believe in diversity. We say that food should be colorful, it should be fiber rich, it should be anti-inflammatory, it should support
Hmm.
the gut microbiome, and it should taste good and bring you happiness.
It's funny because I would like to share one experience of last year, end of last year. I spent some time in India at Ayurveda retreat, and after a few days of fasting, I got some food which looked really not good, and I said, "Why can't you prepare food which looks good?" He said, "Food which is looking good is not good for your body." I said, I think that is I can't sign this because I mean we have so great looking food and in the nature, berries, bananas. I mean it's sometimes a color explosion.
Mhm.
If you tell me this, that doesn't. This is something I don't understand from the Ayurvedic understanding of nurturing the body and the mind.
Mm. I think it's so important to really have something on your plate that is colorful and that makes fun eating it, because this is also what we see in hospitals. The patients are served food which really it has only like two colors, gray and yellowish, white, and this it does not look healthy, and really it is not healthy because it lacks the polyphenols. So our eyes are also trained to see which substances are good for us. And in the old days, so the most colorful things you could find to eat were fruits and vegetables. And of course,
Yeah.
this be integrated in the diet, and it's the major part of the Mediterranean diet.
Yeah, I think so too. And do you follow any mental health or mindfulness routines also? Because you just said, and I can really imagine that you have a very full day and maybe also stressful, maybe positive stressful, but I think sometimes really stressful.
Yes, actually, yeah, I only have some breaths in between tasks, and this is are my regular moments of stillness. So, like breathing, grounding. There's also this what we learn in psychotherapy, coherence breathing. So, 5 seconds in, 6 or 7 seconds out breath, and yes, when I have the time, I just go for a walk. I look at the sky. I love to be in nature because this is where I can recalibrate. And yeah, this is my mental health and mindfulness routine.
I think this is, I think the best recipes are often the recipes nature gives us, right? Because, I mean, we come from nature, we are part of the nature, and seeing us that we unifies with nature or get back to nature would give us also more power, right? I mean, if you look at the journey of your field and what it can create in a society, where do you see the future of nutritional psychiatry heading in the next 10 years?
Mm. I hope or I believe that nutritional psychiatry will become a core component in psychiatric care. At least this is my wish. Before I retire, I want to see that nutritional psychiatry is integrated into psychiatric guidelines, in
Mm,
medical education, and in our daily clinical practice. And I
mm.
also would love to see it to become even more personalized. That, of course, in the future, we will have even more data from a person. We can combine microbiome data, biomarkers, data from the vagus nerve through heart rate variability. So digital tools also, maybe artificial intelligence will help us with that. But my wish would also be that we don't lose this human connection, and that treatment can also that we don't need treatment anymore, and that it can kind of transform into prevention and preventive medicine, so to support brain health before an illness can take hold.
Yeah, very important point. We have unfortunately just time left for one question. What message would you like to leave our listeners with, especially those struggling with food, self-image, or mental well-being?
I would say, yeah, your symptoms are not failures, they are signals. And behind the signals, there is always a story, and this story is worth listening to. And this it does not happen in a doctor's appointment within 10 minutes. So look for a doctor who has time. And your healing can take time. It's not about perfection, it's about reconnection. You need to learn how to reconnect to your body, to your needs, to your own rhythm. And food can be a part of your healing journey.
Thank you so much. It was a great talk with you, with one of the leading voices in nutritional psychiatry. And I hope that we stay connected. And then I hope that we can connect dots and try to make the world a better place. So thank you very much for being here, sharing your insights, and showing us also how positive you are. Because I think in these days where crises, transformation, a lot of uncertainty gives people a tendency into depression and mental illness, it is more important than ever to understand that sometimes the small little things which can help you on a day, the blueberries, maybe the yellow banana, maybe the green salad, to give you a great start into the day. So thank you very much for the engaging discussion and the inspiring insights. And I look very much forward to our ongoing exchange. Yes, and the impact we will continue to make together. So thank you very much for being here.
Thank you. It was a pleasure.